Good morning. Today is Saturday, June 26, 2021. Oh, Facebook has changed. Okay, let me be sure all of you are looking at it and finding it. Let me go to my page to be sure. Finding it. Go to my page. Good. So this weekend, I'm teaching a yoga teachers training course for Zenya Yoga Academy. It's a advanced yoga teachers training, and we will be teaching the Ayurvedic yoga therapy. So we already had a class this morning for a short time, and they have all joined in this Facebook Live. So we went over with them about the concepts of Ayurvedic yoga therapy, but let me have a few more moments and tell you, and we'll start the practice session. The first, Ayurveda, the word Ayurveda, Ayu means your longevity, Veda means your knowledge, knowledge which gives us the longevity. Ayurveda and yoga has the same origin, same root, it's called Vedas. And yoga is a therapy. Yoga therapy means adaptation of the yoga practices based on the patient's or client's clinical condition, based on the Ayurvedic psychophysical body type called doshas. Ayurveda says that we need to be in a balanced life between microcosm and the macrocosm. Microcosm is my body, macrocosm is the universe. Universe is not made according to Ayurveda, not with the Big Bang theory. It was made in sequence. First there was a space. In the space came air. Air had a friction, caused fire. Fire melted the cloud from the water. Water froze into your, call it earth. Space, air, fire, water, earth. Our body has all the 5 components in a different proportion. Space is the space inside my stomach, space inside my colon, in the lung. Air is a movement of my intestine, movement of my heart. Fire is our digestion. Fire is my vision. It's called tejas. Water, the main component of our body. Water is also it's called the holding together. Like if you have a dough, you put the water in a flour, it becomes a dough. Earth is a grounding material. Bones, joints, your teeth. People who have a more higher space and air, they call vata. The quality, they're very mobile. Quality of air, mobile. They're very dry, they're very rough, they're very light. And if you see a person always moving, always talking, thinking 10 things at the same time, multiple projects at the same time, nothing is done. Mentally, they're very anxious, but they're very creative. So you have to balance them. So balancing qualities will be calming, consistency, grounding, slow, steady, strengthening, You have to understand these things, yoga practice, asana practice, pranayama practice, meditation practice, so you'll be able to balance them. So the basic practice is your law of opposite. Whatever their attribute is, you have to practice opposite. Pitta is the main component, is a fire. People who have more fire and water is a pitta. So the attributes of fire, they're hot. Mentally, they're very angry. They're very controlling. They're very sharp. They have features, sharp nose. They're very mesomorphic. Vatas are ectomorphic. Pitta is a little bit of also slightly mobile, it's oily, it's lighter. So all of them, the first will be, Pitta is hot, so practice will be cooling. Sitali pranayam, Sitkari pranayam, left nostril breathing, Chandravedi pranayam, cooling. Diffusive, they don't want any focus, they're always in focus. Diffusive, dull, dry, forgiving, because they're holding on to something, because they're Pitta. They're like a king. I'm the ruler, Forgiving, very gentle, relaxing, surrendering. These are the qualities of the opposite qualities which need to be in a practice. Kapha, main component of water and earth, people with the kapha. The main attribute is earth and water, so they're grounding. They're heavy. They're very soft, they're very slow. They're static, the sticks, the sticky, the slimy. They're heavy, they're hard, they're dense, they're gross, they're oily. So even if a vata person put oil, it just gone right away because they're so dry. And a kapha person, you put oil, it stays there, it doesn't go anywhere. And we see it in our body all the time. So the kapha, the balancing attributes will be your challenging, because they are so grounded, challenging, drying, lightening, because they're heavy, lightening, moving, because they're slow, moving, stimulating, strengthening, warming, weight reducing. These are all, once you can think and you can do the practices very easily and very carefully. Vata people is erratic, so the breathing is very erratic. So their balancing will be alternate nostril breathing. They have to quiet down their mind. The practice will be your bumblebee breathing, Brahmari pranayama. The practice will be your right nostril breathing, because they're cooling. They need the heating. Pitta's breathing is, they have a short exhalation. They generally, Pitta breathes like, even normally they will breathe. So they learn how to extend their exhalation. Because, excuse me, we always practice exhalation longer than inhalation. It's very, very important. We practice every morning your washing our nostril called gel neti. And you do get some drainage throughout the whole day, and it's entirely normal. They will do sitali pranayam, cooling, sitkari pranayam. Kapha, on the other hand, they have a lot of secreting, they're very lazy, so they will need energizing pranayam, like a bastrika pranayam, bellows. Kapalbhati pranayam, breath of fire. Your abdominal lock, Uddiyani Bandh, Agnisar Kriya. We'll do all of them. Meditation wise, Vata needs a focused meditation. Vata will need a practice of sun salutation, but very slow, rhythmic, gaze will be down because they'll be looking all over, and we'll do a practice of Vata. Meditation, they will do a focus on a closing their eyes, on a chanting, or on a flame of a candle, or some picture in front of maybe a ocean, in front of a mountain top. Pitta always listen to themselves, so they will do a meditation looking inside themselves, called introspection. And Kapha, on the other hand, is done, they will do moving meditation. The walking will be the meditation. They will do tratak, eyes, they call it Jyoti tratak, looking at a flame without blinking. Or they will movement their body, very slow movement. It's called west rotation, called a Koti Chakra asana. Vata resides in the colon. So any asanas below belly button, grounding, is your Vata balancing. Sun salutation, very slow, rhythmic sun salutation will be your Vata balancing. Pitta resides in the small intestine, any asana related to your belly button. Camel pose. Or maybe say, lotus pose, laying down, Supta Padmasana, or Janusirasana, head touching your knee. Or your, say, laying down, you can say your, will be your boat pose, Nauka Asana, or bridge pose, Setubandha Asana. And Pitta will do your moon salutation, Chandra Namaskar. Kapha resides in the stomach and high up, so all the uplifting asanas. Mountain pose, tree pose. Sitting down, they will be doing your little bit what you call energizing asanas. There is sun salutation, very faster moving sun salutation. Generally, we do 3, 4, 5 sun salutation in a minute for the Kapha people. Sitting in an asana, cow face, Kapha, Gomukhasana. Spinal twist, Ardha Matsyendrasana. Peacock, Mayurasana. So, let's start. First start with the Vata. Vata is very mobile. They cannot be at one place. So you ask the Vata to concentrate, and the most important concentration with a breathing and also closing the eyes. Remember, we talked about controlling our 5 senses yesterday, part of our teaching program. The moment you close your eyes is the most powerful of our 5 senses. I see, I hear, I smell, I taste, and I touch. The moment I close my eyes, my whole mind quiets down. Mind is the content of your 5 senses. So I will sit down. This is called your Sukhasana. Take your feet, put underneath your knees, cross in the middle. Keep your spine straight and close your eyes. Always in a yoga practice, keep your spine straight. Called Merudanda Achal. When you keep your spine straight, normally what happens, your skeleton is going to fall in the front. The muscles in the back, called paraspinal muscles, they're contracting, they're keeping me up straight. So when I learn how to keep my body straight, spine straight, all the muscle gets relaxed. I feel like two pillows sitting on my sides of my spine. If you feel any sensation, remember the yoga therapy practice is based on your individual practice. It is not competitive. If you feel any pain, back off. Find a place or a pain, you stay here, close your eyes, follow your breath. Lung is like a balloon. It has 6-liter capacity. We need 1.5 liter to keep our lung open. 4.5 liter we can exchange. But normally we breathe only 0.5 liter, 500 cc. The moment you close your eyes, very effortlessly breathe out first. Take a deep breath in without any effort and breathe out longer than breathing in. Do it a couple of more times. If you want to count, you can count. Breathe in, count of 2 in, 1 and 2 in, count of 4 out. If you can slowly can progress, for us, we've been doing it for so long, we can do count of 6 in, count of 12 out, count of 10 in, count of 20 out. Slowly this thing will happen. Simply, let me show you what happens with your whole breathing. And always use a hand mudras. If you put a thumb inside and close, this is the way baby closes the fist. It's called a baby fist, also called yogic fist. Call it a adhi mudra. It relaxes your hand, relaxes your upper part of the body. Relaxes your whole body, in fact. I'll breathe out, a long breathe out. Always breathe out first. Empty your lung, so you'll be able to breathe in. Breathe in with a count of 8 in, count of 16 out. Always breathe through your nostril, and I'll explain to you a little bit more. If you breathe through your mouth, you don't know where the air has gone. Clean your nose every morning. You wash your face, wash your eyes, wash your hair, wash your nostril. Breathe in with a count of 8 in. Breathe out with a count of 16 out. But your breathing is effortless. Effortless breathing means I can talk, I can even sing. Once you're comfortable, then you cross your feet, put together. This is your activating opposite side of your brain. Remember the balance. Yoga is all balance. Balance is we have a right side and left side of the brain. Right brain controls your left nostril, and left brain controls the right nostril. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. Left brain is analytical, left brain is heating, left brain is male, left brain is sympathetic. Once you progress that, next thing you do for a Vata person primarily, take the heel to the back. This is a Vata balancing practice. You put your feet and your knees will drop down. Very nice, simple practice. Stay here for a while. You can do your opposite. You can take the other heel to the back. Same thing will happen. Okay, if it is staying high up, don't push it down. If you push it down, it'll go back high up. Keep it here. Close your eyes. Have the mudras. You can also do a Dhanu mudra or a Gano mudra, the meditation mudra. Touch your index finger and thumb. Put it over here. Do your breathing. And this thing is slowly going to happen. A powerful grounding pose is your half lotus and a full lotus. You can put your 1 foot in the top. You can go into a half lotus pose. If you feel any pain, you back off. Find a place where you are comfortable. Even if it is hurting you, go all the way out. Put it somewhere. Just 1 second. I need to see one thing. Okay. Sorry for this. Coming back. So we are doing it here. The first was here, half lotus. When you're comfortable with this half lotus, what you do, go back, you start the opposite side. The next half lotus here. Slowly, when you're comfortable, easily you can get into a lotus pose. This is a look at the grounding below the belly button, the balancing your vata. Next, balancing your vata will be your yoga mudra. Put your hands in the back, close your eyes, breathe out first, take a deep breath in, slowly drop your body down, so touch your head to the ground. Normally stay here between 5 to 10 breaths. That's what I do. I practice all the time, and it's a wonderful practice. When you feel the sensation of lightning, put your hands here, pull it up. Very easily you can get up, Tolasana. For a Pitta, it is your belly button. So what you can do, you can do a called your Supta Padmasana. With a lotus, you can lay down slowly. And when you lay down slowly with a lotus, your head comes down, your feet will come down, and you will feel that it is at the level of your belly button. And you give you enough time, slowly your whole knees will come down. Since we're teaching today, we're showing you all the techniques, and we're going to show you the asanas for each doshas or your body type. For Vata, wonderful asana is your Vajrasana. You fit here and keep your spine straight. This is your Vata balancing asana. From here, what you can do if you're in a balancing towards your belly button, you can do a cat pose, Marjarasana. In a Marjarasana, you separate one hand, separate both the hands, drop your head down, knee down, look high up, take a deep breath in, slowly arch your body high up. And in yoga therapy, you stay here. In a regular practice, you get in and out. From here, slowly you get high up. You get into your Ustrasana. Remember, all the asanas was belly button. That will be a pitta balancing asanas. So have your body touch camel pose. Will be your pitta balancing asana, sitting down. Go to sitting down, laying down, then we'll get up and do the asana practice. Energizing asanas, this is called a Vaisasana. If you put one knee in the top of the other, then slowly you get into called cow face or Gomukhasana. Always do your breathing out longer than breathing in. Breathe out first, and slowly take a deep breath in and breathe out longer. Just one more thing. I'm so sorry. The Facebook has changed it's a new format, and I'm having trouble looking at it. Okay, so we're talking about your putting one foot in the top, called a Vaisasana, kapha balancing asana. From here, you can do a balancing called Gomukhasana, cow face. Let me turn around and show it to you so you will see what we mean by the balancing. Both the hands should be equal on both the sides. My right knee is in the top of my left knee. My right hand goes high up. My left hand is here. I slowly put my left hand in the middle, take my right hand, drop it down, touch it, hook it, and essentially I handshake each other. I'm totally effortless. I'm talking, I'm breathing. Same thing if you see balancing now. I'm going to put my left knee on the top of my right knee. Left hand goes high up. Right hand is here. I'm slowly putting my right hand in the middle. Left hand comes down. I'm touching it. I'm hooking it. I'm literally again handshaking each other. And I have equally have no difficulties in doing it. This will be your kapha balancing asana. A spinal twist, Ardha Matsyendrayanasana, will be a very nice kapha balancing asana. Your right foot next to your left knee. Your left hand comes outside your right knee. The right hand goes to the back. Left hand goes to your knee and slowly goes to your ankle. And breathe out first. Take a deep breath in and slowly turn your body towards your right side. And you'll see if you keep on doing, if you're doing it with me, you'll see your breath catches. If breath catches, back off. But stay between 5 to 10 breaths in your regular practice. Very important practice. To the opposite side. You have to do effortlessly. Left foot is next to the right knee. Right arm goes outside your left knee. Left hand goes to the back. It will touch your knee and slowly comes to your feet. Breathe out first. Take a deep breath in. Slowly turn it around. For Vata, laying down asana, wonderful asana will be your Pavan Mukta asana, knee chest. So when you lay down, you're slowly laying it down and do these asanas. These are also ignite your Agni, Jatar Agni, which is very important for your Pitta balancing asanas. So lay down, the head is down. Raise your feet up, Padottanasana, body high up, you're in Anokasana. It is your Pitta balancing asana because it is focused to your belly button. From here, you can do your knee chest, Pavan Mukta asana. Bring it close to it, touch your nose to the knee, chin goes in front of knee. You can roll side to side. Then go to the front and back. You can do bridge pose, which will be also, remember, belly button. It will be for Pitta balancing asana, bridge pose. When you get stabilized in the bridge, you can balance yourself, raising with 1 foot high up in a bridge pose. And you slowly come down. Markatasana, spinal twist again. Hands on both sides. Both the knees comes down into the ground, and you look into your right hand. To the opposite side. Pitta balancing asanas. You can do all the asanas. You can do your shoulder stand, even you can do a headstand. You can do your peacock. All these asanas you can do, but most important asanas for the balancing the doshas are a sun salutation and a moon salutation. So the few balancing practices you do, you need to continue all the time. And let me show you what are our balancing practices. Your wonderful balancing practices, which will always practice a relaxation response, able to sit down in a squatting pose. In a squatting pose, this is a very relaxing. It relaxes your ankle, relaxes your knees, relaxes your hips, back, it's everything. Hands together, separate your hands, separate your fingers, relaxes your hand. Extend your wrist. Put your one elbow inside, other elbow inside. Slowly bring it close to you. Keep your spine straight. Keep your eyes closed. Breathing out longer than breathing in. It balances your sympathetic and parasympathetic tone. Relaxation response. It balancing both sides of your brain. You'll be able to get up without a support. Very simply, you get down, get up without a support. I'm comfortable standing like this. See if I can stand with both the feet together. It's a dandasana, or you can say mountain pose. My ear, my shoulder, my hip and ankle in the same line. I'm straight. Practice a little bit more about your whole health. And cross your feet. Sit down, crossing your feet, and get up, crossing your feet. Unassisted, unsupported. This gives you the sign of your health. To the opposite. Always balance yourself to the opposite side. Sitting down and getting high up. Finally, this is another wonderful practice. You can go all the way down to the ground, sit down all the way to the ground, and you will be able to get up unassisted. That's your therapeutic goal. From here, you'll be able to get up without a support. Once you're able to do this, all the doshas will get balanced. Vata, Pitta, Kapha. These are tridoshic practices. When you fall down on your hand. Hand is a balance. If you do a prayer pose to the back, take your hands to the back. Slowly do a prayer pose to your back. Then you balance your both the feet. I'm right-handed, right-footed, see if I can stand on my left foot. 10 seconds, 20 seconds, 30 seconds, 40 seconds. Then I close my eyes, if I can be in a balance closing my eyes. Initially it becomes almost impossible, but it's a wonderful practice. Try this and you will see it will balance all the doshas and get rid of all the underlying disease you have. Can't have a better practice than this. Right foot. You can keep on counting. 10 seconds, 20 seconds, 40 seconds. Close your eyes if you can do it. Even putting in the hands to the back, if you can do a tree pose. You will see if you put your hands in the front, hands in the front and hands in the back, it makes a lot of difference. We don't practice any pranayama, we don't practice any pranayama standing up, but I will show you if you can do the Kapalbhati pranayama, it's a very relaxing. So for Vata, they're always looking all around because they're mobile. So their gaze needs to be downwards. Gaze needs to be a focus. If you do a sun salutation, we put the hands together, put the index finger high up. When you get the high up, we let them focus on the finger and hand goes high up. I'll do it and show it to you. Movement will be very systematic, rhythmic movement. Pitta will do a moon salutation focusing on their self. Kapha, since they're grounding, the gaze will be high up and they'll be doing a faster sun salutation. So let's do a sun salutation for Vata. Feet together, 12 steps. You do the breathing. This is called therapeutic sun salutation. If you start with your breathing in, you'll end up with breathing out. Put your hands together, pranamasana. Since you're Vata, you're doing very slowly, your gaze goes down and your coordinated movement. Hand raising, Hasta Uttanasana, you keep your both the index finger and look at the index finger and slowly raise your hands high up, focusing on this index finger for the Vata people, because they're too mobile in their body and mind. Hand comes down again. Vata people, slowly put your hands on your thigh. Hand slowly comes down. Slowly it will come down. Hands goes to the ground. Hand is on both sides of your feet. And head comes towards your knee. So it's breathing out. Breathing in, left foot goes to the back, right knee comes in front, chest opens up, you look high up. Also Sanchalanasana, horse riding pose. Breathe out, Right foot goes to the back, heel on the ground. You look at your belly button. Parvatasana. Breathe in, Ashtanga Namaskar, touching 8 points of your body, 2 feet, 2 knees, 2 hands, 6, touching your chest, touching your forehead. Ashtanga Namaskar. Slowly you come down. Breathing in. Breathe out to get into Cobra pose, Bhujangasana. And breathing in, get into mountain pose, Parvatasana. Look at your belly button. Breathe out, left foot comes in the front. All the pressure is in the left knee, chest opens up, look high up. Also Sanchalanasana. Breathing in, right foot comes here, hand is on both sides, head comes towards your knee. Breathing out, again you look at your index finger, hand goes all the way high up. And breathing in, hand comes in the front. So started with a breathing out, we ended up with a breathing in. 12 steps, sequence of breathing, therapeutic sun salutation. For Pitta, it's a boon salutation, exactly the same stages, but you take out the heating asanas, heating component of the asanas. So you will see what the Pitta is going to do. We do the opposite side, same sequences, the hands together first. We started breathing out first one. Let's do the breathing in this one. Breathe out first. Take a deep breath in. Breathe out. Slowly, hand goes way high up. Hastuttanasana, hand raising pose. And breathing in for the moon salutation. Slowly come down and you sit down on your feet. Breathe out. Put your one foot in the back and knee in the ground, taking out the hitting poses. Breathe in, both the hand goes high up. Both the hand comes down, left foot goes in, knee in the ground. Both the hand goes high up, breathing in. Breathe out, your hand comes in the front, you get into your child's pose. Remember cooling, moon salutation, Chandra Namaskar. Get up into your cobra pose. Go down. Get up to your cobra pose. From cobra, go back to your mountain pose, but support it. Breathe in, both the hand goes high up. Breathe out, left foot comes in the front. Breathe in, both the hand is up again. And breathe out, right foot comes in the front. Hand is on the side. And very slowly, non-stimulating, head to the knee. Slowly, hand goes high up again. Breathe in and breathe out. So starting with a breathing in, ending with a breathing out. It was a moon salutation for your pitta imbalances. There are three terms in Ayurveda: Vata, Pitta, and Kapha, psychophysical body type. Prana, Teja, and Ojas. Prana is a cellular communication. Teja is a cellular intelligence. Ojas is cellular immunity. Prana, Teja, Oja get balanced. Sattvic, Rajasic, and Tamasic, state of your mind. Sattvic is the purity of your mind. Rajasic is the activity of your mind. Tamasic is your dullness of your mind. For a kapha, we'll do a sun salutation, will be a lot faster sun salutation with the same breathing pattern. So this is a sun salutation for kapha. I'm not going to talk to the asanas. You have already seen. I'm going to do it with my breathing. Breathe out again. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Out. Breathe in. Balance it, do it one more time. Now the breathing in. Breathe in. Breathe out. Breathe in. Opposite side. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. So see, your faster sun salutation for kapha people. Once you understand the concept, many of you are very experienced yoga practitioners. You have all of your asanas and pranayamas in your tool and do it accordingly. For the pranayama, you sit down comfortably with your spine straight. And mind quiets down. It's called Merudanda Achal and Manasthir. Best way to quiet down your mind is closing your eyes. You do all the meditation, do all the pranayamas, and also do all the asanas closing your eyes. Prana is your life force. It's subtle energy which keeps us awake, alert, and alive. Yam is a control and restraint. It's a voluntary regulated breathing, not a breathing exercise. It's I'm voluntarily regulating my breathing. So the first breathing technique is empty your lung. Always breathe through your nostril. Touch your index finger and thumb. If you're sitting in a chair, you can sit down in a chair, put your all the way to the back, keep your spine straight and eyes closed. Always breathe out first. Breathe in through your nose. Breathe in through your nose. Nose is your filter. Air gets filtered. Nose is like your personal air conditioner. Outside air is warm, it will cool it down. Outside air is cold, it will warm it up. Air goes to the side of the nostril called turbinates. Turbinates creates a vortex. It guides the air to go to the larynx, trachea, and to the lung. When the air goes to the vortex over the mucus of the sinuses, releases a substance called a nitric oxide. Nitric oxide is a powerful vasodilator. It opens up the blood vessels. It is the protector of endothelial health. It improves the function of the lining inside our blood vessels. Nitric oxide is a mediator of our parasympathetic tone. The three substances, cyclic GMP, acetylcholine, nitric oxide, creates a parasympathetic tone. If you breathe through your mouth, you don't know where the air has gone in. Has it gone into your stomach or your lung? If you have to breathe through your mouth, you can breathe in through your nose. You can breathe out through your mouth. For a daily practice, we do 1 hour of practice in the morning, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. For the Vata people, generally we start with a longer exhalation than inhale because their breathing is erratic. So let's practice. You're practicing with me. Touch your index finger and thumb, put it over your knees, breathe out first, breathe in with a count of 2 in and count of 4 out. Don't make any effort. Then progress, maybe to count of 4 in, count of 8 out, count of 6 in, count of 12 out, or 12 out, or could you count of 3 in? See, whatever you can do, you'll see your mind will quiet down. Breath is a connector between your body and mind. So breathe out first. Let's do it very simply, count of 3 in and count of 6 out. Count of 3 in. Count of 6 out. Always practice with a smile, effortlessly. And it is so effortless, I can do easily count of 5 in, count of 10 out. Breathe out first, empty your lung. Count of 5 in. Count of 10 out. This will be for your Vata balancing practices. Kapha will do very simple, your active inhalation, active exhalation. So active you can do with your movement, like here. Actively breathe in, breathe out. You continue. I continue for a long, long time. This is your gateway of your pranayama, gateway of your breathing. You can do with a hand raised, with a slow, with a little slow motion, slow movement, medium, and fast. So you can do, I generally do 20 slow, 20 medium, 20 fast. This is one cycle. Then continue. I do 2 cycle, 3 cycle, 4 cycle. But to show you how to do it, let's do it 10 each. Very 10 slow Bastrika pranayam bellows. Breathe in. You can do medium 10. The fast 10. If you're new to practice, you continue it in a few cycles. But be sure you're still talking, you're still singing, you're breathing. Breathing has to be absolutely effortless. Doesn't matter how slow you do, doesn't matter how fast you do, it has to be completely effortless. If you have any effort in breathing, it is not going to have any therapeutic benefit. So we do very simply, we do a hand relaxation. First, we'll do very simple, very slowly, active Bhastrika. Since we're completely effortless, see, I do it every day. I do it 400, 500 practice. Since I practice, I can show it to you how easy for me to do as fast as possible, but completely stay in effortless breathing. Let me show you a little example. I did very simple 100 of them. Have no effort, nothing, no effort in my body. But my whole lung is empty. Take a deep breath in. I can breathe about 3-4 times more than normally breathing. And this is called your 3-stage breathing. Dirghashas. Lung has a 3 lobe, lower lobe, middle lobe, upper lobe. Would you fill up in the lower lobe first? The stomach fills up a little bit. Fill up your middle lobe, chest expands a little bit. Fill up your upper lobe, clavicle will raise up a little bit. Collarbone will raise up a little bit. So, but this is called a yogic breathing. 3 stages breathing. It is basically your daily practice. This is called a prano pradhan pranayam. It brings the prana in my body. Pradhan means main. Brings the prana. Follows with the Kapalbhati pranayama. We have a balloon here, diaphragm here, balloon here. My whole awareness in belly button. I push the belly button to the back. It hits the diaphragm, hits the lung. All the air comes out. Active exhalation. Passive inhalation. I don't even think about breathing. I breathe in between without knowing. Best way to do it is that I do also the mudras. This is called your dhyana mudra or jnana mudra, meditation mudra. Index finger down, push it there, called a vayu mudra. It controls your vata. It's called a shunna mudra. Touch a middle finger and thumb. It helps your hearing. Ring finger and thumb is called prithvi mudra, earth mudra. It is good for grounding, balancing kapha, good for obesity and diabetes. Touch your little finger and thumb, called Varun Mudra. It helps water content in your body and also your bladder function. Ring finger, little finger and thumb, called Shakti Mudra or Prana Mudra. It gives you energy. Ring finger, middle finger and thumb, Apna Mudra. Pachan Mudra, digestion mudra, downward force. Put your index finger down, is a Apna Vayu Mudra. It's for your heart, for your lung. Linga Mudra. It helps your heat, generate heats in your body. It removes your phlegma. Ganesh mudra, removing your obstacle. So do all these things in a mudras, but your eyes are closed. See how I'm doing my. If you want to practice with me, bring your awareness to belly button very slowly, 1 per second. So I did not breathe, or my awareness here. I breathe in between my breathing out without knowing. The day I was born, I took a deep breath in, and nobody taught me how to breathe in. I learned how to breathe out. And again, with the relaxation, I've been talking so long, my mouth is still wet. Mouth is wet, that means it's a parasympathetic activation. When you're afraid, when you're scared, you get a dry mouth. That's a sympathetic activation. So the way we do about 25, 30, 40, sometimes 50. I do a 50 in each Kapalbhati pranayama with each mudra. So let's do a little practice. Maybe do about, just for the practice sake, let's do about 10 count each. And you'll see, and I'll explain to you what this pranayama is. It's called Agni Pradhan Pranayama. It ignites your Agni, the digestive fire. And also you've seen, noticing it when I'm sitting down for a while in one cross-legged, and slowly I change my foot. This is called your balancing both sides of your brain. Very important practice. Change the mudra, index finger down, thumb in the top. You are really balancing your vata. Yeah. You keep on doing, let me tell you the benefit of this pranayama. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your colon, massages your small intestine. For men, it massages your prostate. For women, it massages your tubes, massages your ovaries, massages your uterus. Change your mudra to your Vayu mudra. I close my eyes. When I do it, I'm doing it in silence and just sequence. It's a wonderful practice. Keep doing it. Massages your diaphragm. Above the diaphragm is a lung. It massages your lung. It removes all the dirty air which is sitting in the lung. So this is a detoxifying pranayama. In between the lungs, sitting is a heart. It's also massaging your heart. Change your mudras to your Prithvi mudra. It helps in your obesity and diabetes. Massages your heart from within. Yoga says when you massage your organ function gets better. When your heart stops, what do? We do a CPR, or cardiopulmonary resuscitation. I keep on pressing on the chest. Basically, I massage the heart. So here I'm doing an internal CPR. Little finger, this improves your bladder function, improves your fluid, improves your skin functions of our body. Ring finger, little finger and thumb, Shakti mudra, Prana mudra. Middle finger, ring finger and thumb, Apna mudra. Index finger down, Apna Vayu mudra, Hriday mudra, improve your function of your heart and lung. Linga Mudra improves your heat and remove your phlegma, excess phlegma. You also practice called breath holding. Breathe out first, take a deep breath in, hold your breath. It's called your Abhantarin Kumbhak. Kumbhak is a breath holding. Purak is a breathing in, Kumbhak is a breath holding, Rechak is a breath out. Breath holding or inhalation called Abhantarin Kumbhak, breath holding after exhalation called a Bajja Kumbhak. We practice what is also called your locks, chin lock. So first you practice, you see, it's called your abdominal lock. Then we practice, you breathe out first, take a deep breath in, completely breathe out, suck your stomach in and hold. You also can incorporate chin lock with it. Chin lock basically, don't bend your knee, neck, bring your chin towards your chest. It massages two organs on the side of your neck called your carotid sinuses. It activates your parasympathetic tone. Very calming and cooling practice. Jalandhar Bandha or chin lock. You can massage the whole abdominal contents. Remember, after vital organs, all the disease are from these abdominal organs. You will do your suck your abdominal wall in, and then you massage your whole abdominal content. Agni Sarkriya. Breathe out first. Take a deep breath in. Completely breathe out. It is all in the movement of your abdominal wall. Wonderful practice. Very good for diabetes, for truncal obesity. Very good for your kapha disorders. For vata, alternate nostril breathing. Touch your left hand, index finger and thumb. Right hand, close your right nostril. You don't have to close all the way down. Just put your thumb underneath. Breathe out through left nostril first. Then breathe in through your left nostril. Drop your hand down. Close your left nostril with the ring finger and little finger. Breathe out through your right nostril. Breathe in through your right nostril. Close the right nostril. Breathe out through your left nostril. Keep doing it with eyes closed. And also what you can do, you put your index finger and middle finger in between your eyebrows, the third eye. Close your eyes, focus it here, and do alternate nostril breathing. You keep on doing it. Let me tell you the benefit of this. Normally, you will see your one nostril is more open than the other. Right brain controls your left nostril. Right brain is intuitive. Right brain is cooling. Right brain is female. Left nostril breathing is called parasympathetic cooling, moon energy, Chandra Nari. Pranayam is called a Chandra Bhedi Pranayam. Right nostril control is by the left brain. Left brain is analytical, left brain is heating, left brain is male, left brain is sympathetic, and the nadi is called a Pingala nadi. Left nadi is called a Ida nadi. It's a sympathetic activation, a heating. It's called sun energy, Surya nadi, called Surya Vedi Pranayam. With the alternate nostril breathing, you get both the nostril opens up a central channel called Shushumna nadi and balances both sides of the brain. Very important pranayama for neuropsychiatric disorder, Vata-related disorder. Vata people gets a neuropsychiatric disorder and musculoskeletal disorders. Pitta people gets your inflammatory disease and your disease of the solid organs, liver, heart. Also, you can do one thing. You can, in the left hand, hold on to your left ear, right ear lobe. This is your super brain yoga and balances both sides of your body, and continue your alternate nostril breathing. To be proper, correct, and balanced, you can also use your other hand to do it, same sequence. How long you do it? As long as you can do without having any effort in your breathing, and you keep on increasing it. If you can do 5 to 10 minutes, is great. Same way as like a Kapalbhati Pranayama. Do it first time, you maybe do only 30 seconds. It's great. Don't push yourself. You're not competing with anybody. Only person you are competing against yourself. You'll see when you do that, when you can access your subtle body. The gross body, subtle body is body of your mind. Close your eyes, you can clearly see your body. You can, closing your eyes, you can touch your tip of the nose. You can touch your left hand, touch your right knee, touch your right great toe, touch your head, touch your neck, touch your right shoulder. So you're able to do alternate nostril breathing without closing your nostril. There'll be meditative alternate nostril breathing. There'll be meditation for the Vata. A Brahmari Pranayam, bumblebee, you shut down your 5 senses. The brain has a frequency. You create a frequency like a bumblebee, and you quiet down your mind. Very good for Vata people. Index finger in the forehead, 3 fingers to close your eyes, and thumb to close your ear, close your mouth. Shut down your vision, shut down your hearing, smell, and taste. Breathe out through nostril, take a deep breath in, breathe out with the sound of a bumblebee. The pumming and cupping, it's a wonderful practice to relax your eyes, to relax your whole face. It helps you removing all the wrinkles, helps you improving your vision. You're wearing glasses, remove your glasses, put both the hands over your eyes like a cup. Let the eyes take all the heat, massage your forehead, massage your eyes, massage your face, massage your ear, behind the ear, front of the ear, even inside the ear. This is called an auricular branch of the vagus nerve. It activates your vagus, activates your parasympathetic tone, massages your carotid sinuses. Go back, massage your insertion, the 2 muscles called sternomastoid muscle and the trapezius muscle. Both are supplied by the cranial nerves. It's a wonderful practice. For Pitta, for cooling, you do your Sitali pranayama. A little closer, so you'll be able to see better. Roll out your tongue, go down your mind first, roll out your tongue. Breathe in through your folded eyes. Remember, don't breathe through your mouth, but this is the breathing to cool it down. Eyes are closed, breathe out through your nose. In a short time, you'll feel a coolness inside your body. Very good for women with hot flushes, gastroesophageal reflux, pitta-related disease. Somebody says, I cannot stick my tongue out. The Sitkari pranayama, do it through your teeth. Teeth, touch your tongue high up. It's also called Sadanta pranayama. And then for pitta imbalances, your left nostril breathing. Left nostril is a calming, cooling breath. There are two ways of doing it. Close your right nostril, breathe out through left. Always start with the breathing out. Breathe out through left nostril. Breathe in through your left nostril. Breathe out through your left nostril. Or you can breathe in through your left nostril, breathe out through your right nostril. Breathe in through your left nostril, breathe out through your right nostril. There's a technique, and you do it as long as you're very effortless, and if you can do a minute or two, is great. On the other hand, for the Vata, you will do right nostril breathing. Right nostril heating. So you close your left nostril, breathe out through your right nostril, breathe in through your right nostril. Breathe out through your right nostril, breathe in through your right nostril. Or you can do breathe in through your right nostril, breathe out through your left nostril. Breathe in through your right nostril, breathe out through your left nostril. Ujjayi pranayama is very important. You slowly constrict your larynx and slowly try to breathe in. It's a resistive inhalation. It activates your parasympathetic nerve because larynx is supplied by a vagus nerve. It activates the vagus nerve. And the vagus nerve is active. Relax. When your whole body gets relaxed, automatically you see you'll get into your abdominal lock with the Anibandh. Then you will get into a chin lock, and chin lock will do your left nostril breathing. All calming, cooling, totally quieting down your whole body, mind, and Vata imbalances. My hand is in a very relaxing, called Adhi Mudra or a yogic mudra or a baby fist. Breathe out first. Take a deep breath in. Completely breathe out. Wonderful. It's almost a meditative pranayama. Meditative pranayama is called a pranaho pranayama. Chanting Om. Om has a three component, A, U, Ma. A comes from the lower part of the lung. U comes from the middle part of the lung. Ma comes from the upper part of the lung. You did three mudras. When you touch your index finger and thumb, palm high up, it is called your meditation mudra, dhyana mudra, or Gana mudra. Hands down is called a chin mudra. It opens the lower part of the lung. Closes the hands down, it's called a chinmayi mudra. It opens the middle part of the lung. And when you put the thumb inside and close, the Adhi mudra opens the upper part of the lung. There's three mudras. Do a A-U-Ma, that's a pranaho pranayam, meditative pranayam. See, you don't do a meditation. You prepare your body preparation or relaxation response. In yoga, it's called a sthiram sukham asanam. Sthiram means stillness, sukham means happy, asana is a pose. Breathing becomes completely effortless. Your breathing is so silent. Some yogis breathes next to me, breathing about 2, 3, 4 breaths a minute. You don't even know they're breathing. Mind quiets down. All the thought process in between goes away. The gap becomes bigger and bigger. You enter into a state of meditation. Meditation is medication. You're in a meditative state throughout the whole day. We'll practice two meditation. First, it will be your A-U-Ma meditation for your Vata. Vata also does meditation through your breath centered. Vata can do also through your alternate nostril breathing. Like here, my eyes are closed. I'm visualizing my breath. Visualizing my breath coming in through my nostril. Breath is getting filtered, it's getting warmed or cool. Breath is going to the larynx, going to the back of your throat, upper part of the lung, middle part of the lung, lower part of the lung. Breath is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind my throat, it's coming out. I do all this thing in silence, but since I'm showing it to you, that's what I'm talking. Breath brings up prana, a subtle energy which keeps us awake, alert, and alive. Breath is like electric cable, prana is electricity. Breath is bringing prana. In yoga, whole body does the breathing. Breath is taking the prana to the organ of healing. I have a heart problem. I'm visualizing prana coming to my heart. It's healing my heart. If you have diabetes, you visualize prana is coming through your pancreas, healing your diabetes. Back pain, you visualize prana is coming through your back, correcting your back pain. Goes to your knee pain, hip pain. You always can do an alternate nostril breathing without closing your nostril. In silence, eyes closed. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Feels like impossible initially, but keep doing it with your eyes closed. You'll eventually do it, and you'll find such a relaxing, comforting. So we have this. We have your Apple Watch, we have health tracker. I can see my EKGs. I can see my heart rate. We know this thing is happening. When I touch it, I can feel the capillary pulses. All my nerve sensation goes down. It's a wonderful practice. Pitta does the breath-centered meditation, but always focuses on self. Kapha needs to be waking up, moving meditation, walking meditation, or they can look into a finger meditative way, looking at it, and keep looking and looking. Or looking at a flame of a candle. Or they can do what is called a Kati Chakrasana. Slowly move your hand, eyes closed with the breathing. Like here, we'll breathe in, breathe out. You can do it even standing high up. You can do sitting in a chair, sitting in a ground. It is called West Rotation Pose, Kati Chakrasana. So once you have the concepts, you can use your tool. You can get a toolbox, you can find the tools and use it. Let's finish with the Pranava Pranayam. And Pranava Pranayam is the A, U, Ma, and with the 3 hand mudras. First, Chin Mudra. Index finger and thumb, put your hands down. Breathe out first, and it will be A, lower part of the lung. Deep breath in through your nose. Change your mudra, Chinmay mudra, U from the middle part of the lung. Change your mudra to Adhi mudra, opens upper part of the lung, and it's a Ma. Slowly bring up both the hands in front of you. Touch your little finger and thumb. Separate your index finger, middle finger, and finger. Lotus Mudra, Padma Mudra. It connects your body, mind, and spirit. Slowly bring it close to your heart. Heart is the site of the soul. You always say, memorize by heart. There's a reason for it. Ayurvedic yoga therapy corrects our imbalances of the Vata, Pitta, and Kapha, corrects the imbalances of the Prana, Teja, Ojas, imbalances of Sattva, Rajas, and Tamas. It corrects the whole body. It is not a reductionist practice, it's a holistic practice. Put your hands again together in front of your heart chakra. Slowly rub your hands. Slowly rub your hands. When you feel the warmth in your hands, if you're wearing glasses, Remove your glasses. Take both the hands like a cup. Put it over your eyes. Let the eyes take all the heat from your hand. Massage your forehead. Massage your eyes. Massage your face. Massage your ear, behind the ear, in front of the ear, inside the ear canal. Bring it the hand, massage your carotid sinuses, massage the back of the neck. It's a wonderful practice. It's all about Ayurvedic yoga therapy, and we've been teaching a lot of classes. Because of the International Day of Yoga, we are missing a lot of Saturday morning classes because I have a lot of other assignments. Once the assignments are over, we'll come back to the regular Saturday morning classes again. Hopefully, we'll be able to do it in the next Saturday. Please keep an eye on my Facebook page, and we'll see we'll do a class in the next Saturday or not. Okay, thanks for the joining. Keep in touch. I see a lot of comments. I cannot read it now, but I will read them and I'll answer most of them. Thank you for joining.